Welcome to the campus of North Idaho College and today's broadcast of the North Idaho College Public Forum. The crew is comprised of North Idaho College television students. Your moderator is North Idaho College political scientist, Tony Stewart.
Today we are going to discuss a topic that has had a lot of publicity in the last few months or years, particularly the last few months across the country. We hear a lot about the problem of herpes and how that is transmitted and if there is a particular treatment and if it can reoccur. In order to discuss that important topic, I'm happy to welcome to the program three guests. To my far left is Melissa Clark, who is with the Spokane Planned Parenthood and has worked in this area, not only there, but back east also. We also have with us Dr. Frederick Ambrose, who is a medical doctor in Coeur d'Alene and has been here for approximately 6 years and is a specialist in this field, and we're happy to have him with us. Our third guest is Jan Palmer, who is a registered nurse and works for the Idaho Panhandle Health District, and she too works in this given area and has much expertise. It's my pleasure on behalf of our staff to welcome all three of you to our program.
Thank you.
And as always, I'm very happy to welcome back regular panelist Janelle Burke, who has been with me a number of years and assists in the questioning, and I will invite her to commence the questioning.
The first question is addressed to Dr. Ambrose, and then if Nurse Jan Palmer would like to fill in, what is the disease? Exactly what kind of disease is it? Something about the history of the disease. How is it similar or different from other venereal diseases? Beginning with Dr. Ambrose.
Well, first of all, herpes is a sexually transmitted disease, as are gonorrhea, syphilis, and a host of others. It differs from those diseases, and this is belongs to the virus group as opposed to bacteria. Viruses are much smaller particles and do not respond in the same way as bacteria do to various antibiotics. Herpes has probably been with us for a long time, although only recently has it become brought to the public's attention. And that's because we are now seeing so much more of it. Herpes has been around from my studies back in my reading from the 40s and 50s, not that I was reading then, but rather that the studies done then showed that there was herpes in the prostitute populations in large cities, and that this is actually associated then with an increased incidence of cervical cancer. So herpes was certainly around then. How much earlier than the middle of this century, the early years of this century, it was part of the venereal disease problem, I really can't say. It's the sort of thing that would be hard to diagnose, and because it's a self-limited disease and only extremely rarely is going to be a fatal disease, it didn't get the attention of, say, syphilis, which was obviously known back around Columbus's time and so forth. The problem, and the reason it has become more apparent recently, is that herpes is not curable. That is, syphilis and gonorrhea and the other venereal diseases can be treated with antibiotics. In the vast majority of cases can be cured and eliminated from that individual. On the other hand, herpes cannot be cured. Once an individual is infected with herpes, they tend to carry herpes for probably life. Therefore, the reservoir of people afflicted with herpes is going to increase with time, and with the so-called sexual revolution and presumably more sexual contacts, more people are becoming affected. So we're seeing more total number. Also, this is something that's come out of the inner city, is now affecting the middle classes and upper middle classes, which just by the nature of the news media and so forth is going to draw more attention to the problem.
Can you tell us what some of the symptoms are of herpes?
Generally, when I see a patient with herpes, they come in with itching and burning. This is a very common affliction in women and is associated with numerous different types of vaginal infections. Usually I know even before I do an examination, however, that herpes is going to be the problem because it's going to hurt. These women usually have relatively severe pain. They often have difficulty urinating, will have a lot of swelling, usually have a discharge with it. and on examination have very classic lesions that would be very hard to confuse with anything else, with the possible exception of syphilis.
Do you have something that you would wish to add?
Sure. The herpes infection itself is commonly seen both in the oral area around the mouth and in the genital area. And I see patients both with the genital infection where they're complaining of the pain, the burning with urination. Men are complaining basically of the discomfort that they're having. And on exam, it's pretty easy to determine that that's a common lesion. We do cultures to verify it, but that takes some time. The oral lesions we see, and people are concerned because they never knew prior to the media expounding on it lately, that those cold sores are herpes and they are infectious and they can be spread sexually as well as from kissing or just affection among family members.
In your presentation to the students today, Jan, you indicated in the slides that you presented that there were more than one type of herpes. You gave a list on the slides, and you also indicated, I believe, in addition to the two things you just mentioned, that there's some other viruses, or maybe I'm stating this wrong, that the virus has different effects. Could you explain that a little more clearly to the audience here, what I am asking you?
Okay. The virus itself comes from within a virus family.
That's what I'm getting at.
And within that family is chickenpox. The varicella zoster virus is in the same family as the herpes virus. Also, the EB virus, the Epstein-Barr virus, which is the common cause of mononucleosis. These viruses are also within the herpes family.
Okay. And in relation to that now, when you're getting into the herpes that you're talking about, that this program is mainly emphasizing, that are transmitted sexually, is it possible to have herpes that appears one place and not another one? You've mentioned the oral herpes and you've mentioned the sexual organs and herpes. Do they appear both places, or can they just appear one place? Or?
They can appear in both places. Generally, if there's a cold sore present, they pick up a genital infection, the genital infection will be milder because they still have some antibodies from that cold sore, and they'll have less of infection in the genitals. But you can have them in both places, as well as they can occur on the hips, on the buttocks, even on the hands.
Okay. Maybe we go back to you for a minute, Dr. Ambrose, and talk about a little more identification, because one of the purposes of this program, it's an educational program, is to give the viewers as much information as possible that they can use that will be helpful to them. If there are individuals who are viewing this program that either feel that they have that problem or another member of the family has it and so forth, what kind of self-examinations can they do? I'm asking you to be just a little bit more specific, even before they go to the doctor. Certainly advocating that they come, but just to make this process a little bit clearer to them so they'll be more willing to do so. You have mentioned that in your expertise that you'll almost know immediately, but can you give the viewers a little bit more information about how to identify it more clearly?
Fine. I deal exclusively with women because I'm a gynecologist, but I will expand this to include men because the lesions essentially will look the same, although in a different part, obviously, of the anatomy. And on men, it's very obvious they have external sexual organs, and the area that's involved, which is the penis, is almost always going to be easily identified. They look like either small blisters, which haven't ruptured yet, or small craters, and I'm talking about something maybe a quarter of an inch across, somewhere in that area, and there will be redness around that, and they will be exquisitely sensitive. They will hurt a lot. If somebody touches them with, say, a Q-tip or a toothpick or something, it's going to be hot. It's really going to hurt. The same thing with women. Obviously, women are going to have to use a mirror to be able to see, because usually the lesions are going to be actually right at the opening of the vagina, around between the hymeneal ring, out across the labia majora and minora. Sometimes they'll be along the perineal body, that is the area between the vagina and the anus, the rectum. Again, they're going to look the same. There will be anywhere from one to innumerable areas of red surrounded irregular craters. These aren't little round craters, perfectly round, but rather they tend to have irregular borders. And again, they will be exquisitely sensitive.
Janelle Burke.
If a person should discover that they do have herpes, then what happens afterwards? And Melissa, can you tell us a little bit about support that might be given to the person who discovers that they have herpes and what they can do from that point?
Sure. I think there's a normal sequence of reactions to learning that you have any type of disease that doesn't have a cure for it and may be with you for a while and will probably affect you in lots of different parts of your life and your lifestyle and your relationships. What normally happens, what I see when I work with individuals in the support group or what clinicians experience also, I think is there's a natural numbing or a shock in response to the diagnosis of the disease, very similar to learning of an unplanned pregnancy, something that really changes that individual's life and is a crisis for them. After that period, they then begin to search for a cure, anything that will convince them or let them know that this is going to be manageable in my life. And my sexuality is still with me. I'm still a sexual person. I still will be able to have relationships with people. I think that's a common reaction that people experience. And then another thing that happens, a lot of times there'll be several fears that can generalize into lots of different areas of their life. The things that people generally think of right away are contagiousness of the virus. How do I know when I'm contagious? How do I communicate about that to other people? Other things are a fear of cervical cancer and the connection between that and the diagnosis of genital herpes. And then finally, pregnancy. What happens if I haven't had children, plan another child, and my having herpes? And I think Jan and Fred can also address that some too. Other things that happen, essentially what happens to the individual is I've lost control of my life when I find that I have a diagnosis of herpes. And what we need to realize is that in helping that individual start to risk themselves again in relationship with other people and sexually is to let them know that they are okay and to begin to accept themselves as not a herpes virus but as someone who is subject to a recurring virus that and give them as much information as you can. It's important to give them statistics like the number of people that have this disease and some other kinds of things like that. I think that's our way to deal with something that's scary and nobody knows very much about. I'm going to get all the facts that I can about this, and then I'm going to be able to better deal with it. And after that, there's some other stages that we need to address too, which is supporting that individual in their relationships and beginning to start that process again.
I would like to pursue this one step further with you, Melissa, because you did a very excellent job with the students today. You help organize support groups, and maybe this would be a good time too to tell our audience, since much of our audience is in Spokane, how they could contact your office. What is the purpose of a support group, and what are some of the things that you deal with other than what you've talked about already concerning how you help individuals to have self-esteem and how to cope with their family or with their spouse or with dating and so forth. You went through a list, and we're always
Sure.
limited on time on this program, but if you go a list through what some of the basic problems are and what you say to those people to be
Sure.
helpful.
Okay. I think the support group that we are sponsoring through Planned Parenthood of Spokane is held the second Thursday evening of every month at our clinic at West 521 Garland. It starts at 7 in the evening, and it is a strictly confidential meeting, meaning that we welcome anyone who wants more information about herpes, who may be a family member or who is affected by the disease, him or herself. I think generally what's a common or what I see happening is many times that individual who has herpes gets into a real vicious cycle, and that what happens is I feel I accept society's stigma that I'm different from everybody else because I have this disease, and so I'm going to accept a little part of that, and I'm going to start feeling not quite okay about myself. And what that means is I probably am going to communicate that defensiveness and that feeling of lowered self-esteem to any kind of social contact or any dealing with intimacy kind of contact where I want to establish trust with another person. Of course, we're not going to tell everybody in our lives that we have herpes, but to be able to decide this is a person who I would like to have an intimate relationship with, that means that I need to share all parts of myself. And when I do that, I want to feel real good about myself. I don't want to feel like I'm passing and not going to share everything. But what happens is with a herpes patient is they don't really accept that they're okay, so they communicate that. And then they may get rejected. And when they get rejected, then that lowers their self-esteem a little bit more. And so how do they get out of that? I think just reassurance that they are okay and that having herpes doesn't make them any different. And then also as a family member, validating that what they're experiencing is real. I think a lot of times herpes patients, that's not acknowledged. Sometimes friends will say, that's okay. If it's somebody that you really is important to you and really cares for you, then it's not going to make a difference to them. And I don't think that's real fair. I think we need to say, sure, it is going to hurt, it is going to be painful. It's just like any other kind of grief that we go through. There will be some stages, and you'll have to deal with this the way it's going to change your life. But you can do it. You know, kind of a more positive approach to that is what a support group is all about. And it's amazing the number of people who are simply helped by meeting another person who has genital herpes. Just sitting in another room with maybe 4 or 5 other people who are willing to talk about that and share it is very helpful.
Jan, you also had something to say along this line today I thought was helpful to the audience. You indicated that in relation to what Melissa is saying, that some people give up relationships when this happens to them, or they think that as for the rest of their life they cannot be intimate with another individual. Could you inform our audience to some of the ways in which people can continue to be sexually active and yet show respect for their partner and not transmit this if the partner does not have the disease? Would you explain that?
Sure. A lot of times I'll see patients more than once. The first time when they're told their diagnosis, they really don't hear all that you want to have them hear. And a lot of times they'll come back a week or 2 later and they'll want to hear all the things that you said again, because they'll get home and say, I don't remember anything. You know, herpes sticks there and everything else kind of floats away. And when they come back and they say they've sworn off sex, they're never going to have sex again. You know, my boyfriend's gone, he's mad, he's gone. And I talk with them about the use of condoms, the fact that condoms are not really safe against a viral infection, but they're the best barrier we can offer as far as having just sex. And where intimate relationships are concerned, I think that it's a good thing to build on the relationship first and then introduce sex and the herpes once that relationship shows some promise to be a lasting type relationship, something that you want to consider. If sex is going to become important in a relationship that's not lasting, I think it's only fair that the person with herpes let that other person know and let them make that decision whether they want to have sex or not and take that risk.
But when is there a period that's the safest for the individual to be intimate when they have herpes?
Sure. The lesions themselves, when they are present, are very painful, and most commonly we don't see patients having sex when those lesions are there. It does happen sometimes, but generally speaking it doesn't. We are seeing that the virus can be cultured from the cervix of a woman like a week prior to the lesions occurring, and 2 weeks after they've healed, the virus is still there. So it's apparent that the infection can be spread when the lesions are not there. I don't think that's real common, but it has to occur at some time, and people are not usually having contact when they have the lesions. Generally, we tell people when you don't have the lesions, it's the safest, but it's not a guarantee.
But statistically speaking, I believe you pointed the fact that it's a very small percentage, the chances of transmitting it during a time when you do not have the symptoms.
You know, you're much higher chance while you have the lesions of transmitting it.
Yes. Dr. Ambrose, there's another area that we're just trying to cover so much in a short period of time. Women who are pregnant and who also have herpes become very concerned, obviously. Could you shed some light on this for our audience about what are the chances of the child being affected by this and how you deal with that as a medical doctor?
And I'll just break that down into two parts. As far as the unborn child within the womb being affected by a herpes infection, probably not. And as opposed to something like rubella, German measles, where a baby is going to have severe congenital abnormalities from a infection early in pregnancy, as well as there are other viruses that can do that. Herpes probably is not associated with birth defects. I think that if a mother in her early stage of pregnancy gets her first herpes infection and actually gets the systemic illness, which goes along with maybe a flu-like syndrome, something like that, that may be different and that may be fatal to a fetus and they may miscarry. Our main concern is to avoid contact of the herpes with the baby during the birth process. Herpes in a newborn acts totally differently than it does in somebody who is over, say, a month old, and that a newborn has no defense against herpes. And what happens is they will get an overwhelming and devastating infection which will go to the central nervous system. Herpes has an affinity for neural tissue. And those babies usually die. Most of those that survive have varying degrees of mental retardation and so on. And only 10% at this point seem to come through unaffected. We're making some inroads in that regard in that there are some newer medications that seem to help. But whether that's going to reduce the number of affected kids, that is, kids that grow up and have problems later in life, I think it's too early to tell. So our main goal is to avoid contact of herpes with the newborn. And in that regard, we will monitor the mother very closely in the latter stages of her pregnancy, do weekly cultures for herpes, usually of the cervix or any lesions that are present. And if any of those cultures are positive within 2 weeks of labor, or the woman has any signs or symptoms of herpes, then that woman will undergo a C-section. We avoid the birth canal that way, and therefore eliminate the chance of contact. We have not found any problems in mothers who have had C-sections, who have had active herpes, in giving herpes to those kids afterwards. We, of course, instruct them on hand washing and personal hygiene.
So you really have a quite safe mechanism to use for a pregnant mother, potential mother, to prevent that problem. Very good.
We do.
Janelle Berg.
Beginning with Jan and moving on through all three of you, what do you recommend for prevention of the disease?
Okay, as far as prevention of spread or prevention of obtaining the illness?
Let's talk about it both, and perhaps you would like to talk about spread, and then doctor can talk about the other subject.
Okay. As far as prevention, as the herpes patient would want to block the spread from them to their partners, it's wisest, of course, not to have contact, and we tell them this when they have the lesions. If they have any question in their mind whether they're going to be contagious or not, use a condom that will help protect the other person, and let the other person know, and let them make the decision whether they want to take that risk. Oftentimes I hear from my patients that this person told them after they had contact, oh, by the way, I have herpes. And that's very harmful. It hurts them a lot, and they're terrified when they come to see me. And all you can do at that point is tell them the incubation period and say, I hope for the best.
I think just being aware of that herpes is around is the key thing, in that not to get involved in a relationship on any kind of an immediate basis, and to ask any individual that you're getting involved with whether or not they have herpes. That to me is the only foolproof way, and then just not get involved with somebody who has herpes. That's a pretty harsh way, but as far as just a cut and dry prevention of transmission of the disease, I think that's the only foolproof method. It's kind of unfortunate, but that's it. Let me just expand one little bit. When we were talking before, I think obviously herpes is spread at times when it isn't particularly symptomatic. Otherwise, it wouldn't be around so much. It hurts when people have herpes, and they're usually not interested in any type of sexual activity. So therefore, just by common sense and deduction, herpes is spread at other times when it is not particularly symptomatic, or maybe when it's totally asymptomatic.
Melissa, I would like to go back to something that you said again. I've had the advantage of hearing your speech before this, and therefore it makes the questioning easier. You said something really interesting today at the program when you indicated that with the work that you do with support groups and so forth, that oftentimes after a traumatic period of time in which they have to deal with this problem, that some individuals come out of this in a very, very positive way, and in fact that it was almost ironic that some people come stronger after the process, or they have even closer relationships, or they have even a stronger self-image. What did you mean by that comment? Would you elaborate?
Sure. Sometimes I can explain something better by giving an example. I think that being a herpes patient is very similar to if we could look at someone who is having to face the possibility of dying earlier than they thought, maybe a cancer patient or someone like that. Usually that person has to come to accept something that's very, very different about him or herself. And to do that, to be able to accept yourself with all the different parts about you, and it may be herpes, it may be that you have cancer, it may be something else. For someone to have to do that, most of us aren't confronted with something that is that large in our lifetime. And for those people who do, for people who go through those stages and come to understand that I'm just as okay as anybody else, they really have a whole lot of self-worth after that process or during that process. And of course with the herpes patients, it's not something that is over and done with and complete. It may come up again in another relationship, or it may come up again in another part of that person's life. And that's something that makes herpes real unique too. But if somebody can deal with that and come to terms with that, then, and in relationship to other people, then that's a very worthwhile process for someone to go through.
Am I reading you correctly when you say that not only this disease, but other problems people might have, cancer, whatever it might be, that when an individual has to deal with something, it's very difficult for them and to cope with it, and if they're able to do that mentally, that oftentimes they become more candid, more honest person, and have even more honest relationships than most of us have with other people. In other words, maybe they're the most honest and can create the most trust.
I definitely wouldn't advocate getting herpes so that you
No,
could go through that growth process.
Right.
But I think that the people that I've talked to, as I've gone through with them that process, I do see that very often, that there is more honesty and there's more directness.
Again, I'm going to go back to Janelle, but before I do, I think while I'm questioning you that it's appropriate, and Jan, I think that you probably have this too. You both have given me some brochures that are part of the public, and I would just show these to the audience. One of them is put out by the American, I believe, Social Health Association. It's called Some Questions and Answers About Herpes. Then we have another brochure called Some Questions and Answers About Herpes that's a little different, and it's also put out by the American Social Health Association, and Herpes Alert is a third one that is distributed by the Information Center on Herpes Disease. Jan, can I get those from your center?
Yes, you can.
And
there's also an excellent group that is part of is the American Social Health Association Herpes Resource Center, and they have established self-help groups in several different cities in the country, and they have materials. They also have a hotline, and they have a newsletter that's put out quarterly, and someone can become a member of that group and support herpes research and support groups. So that's a good idea.
now, speaking of a hotline, do you have one either in Spokane or one here in Coeur d'Alene, or do
There's
they
a
have
national hotline that's
Do
available.
you happen to have that number?
No, I don't.
Okay, but they could call your office and then you
Right.
could give them that number.
Sure.
Maybe we should do that too. We're trying to do a public service, and first of all, Jan, could you give them your number where they could call you at?
Sure, it's 667-3481, and that's the Panhandle Health District, and ask for Jan Palmer or the Sexually Transmitted Disease Clinic.
And that's in Coeur d'Alene area code 208. Do you have
And I'm at Planned Parenthood Spokane, and the number there you can reach me at is 326-6292.
Janelle, we have time for one quick question.
Well, Dr. Ambrose, if a person suspects that they have herpes, why should they see a medical expert?
Number one, to confirm it, not to confuse it with something else. For example, syphilis, which can be devastating and even fatal if left untreated over a long period of time. And then once a person knows, I think they can then act responsibly with regard to other sexual partners they may have, contacting them, or avoiding future sexual contact with somebody who doesn't have herpes. And my particular concern, of course, is in women, in that the diagnosis being positively made can make a large difference in how they are managed during the latter part of any future pregnancy.
And very, very quickly, is there a new drug on the market that is somewhat better than what you've had in the past?
There's a drug, acyclovir, which the trade name is Zovirax, which does shorten the duration of especially the initial infection and decreases the severity of that infection as far as the symptoms.
Sorry to interrupt, but the clock always wins on this program. We're out of time, and I want to thank all three of you for your very informative comments. Ladies and gentlemen, I hope you've enjoyed the program and that you found this very helpful, and it certainly is a very serious and important topic. Be with us again next week at this same time when again we'll discuss what we believe to be a very important issue. Please have a good week. I am Tony Stewart.
The North Idaho College Public Forum can be seen at this same time each week over this station. This production was videotaped earlier by a North Idaho College student crew for viewing at this more appropriate time.